bone broth that I made now.
Oh,
Yeah, I
great.
made that out
Even
of a
better. Oh,
organic chicken carcass. Well,
yeah. Oh, yeah,
chicken,
yeah, yeah, yeah.
organic chicken. What do you think, Muff? Well, we're live right now. Welcome to the Beach Report, you guys. We are still working on making Muffin healthy. Oh, great. That's
You
wonderful.
missed it.
Uh-huh. Fantastic.
Oh my
Yeah, that's
god.
great. That's just fantastic. We love when that happens.
Oh, it's such a teeny tiny amount.
Uh,
Okay.
oh, it is. It's
That
like
is so
it.
funny though. She didn't even hesitate. She just went.
No,
Listen,
she
when you gotta
doesn't.
go, you gotta
The
go.
whole
It
world is
happens.
Muffin's toilet. Just this is why I have pee pads everywhere
Oh
because
yeah.
I don't
I get
I
it.
expect I take her out as much as I
Oh
can,
yeah.
but we just ate, and so yeah. So hi guys, I'm here with Tracy again.
Hi.
And today we've noticed, both of us have noticed a little
Yeah.
difference in Muffin in the way that she's not behaving so much, but
Yeah.
physically,
Her mannerisms,
yeah,
like her body language.
little twitchiness going
Yeah.
on. Tracy thinks that she might be having some pain, and it
Yeah.
might have to do with yesterday's struggle,
Yeah.
because the struggle is real.
The struggle is real. The struggle was real for me. I
Yeah.
wasn't sure what we were gonna do, and
Here, I'm
sometimes,
gonna let you talk for a second, and I'm gonna go
yeah.
clean up our situation and
Speaking
get
of
her over
that,
here.
struggles do happen, and sometimes you have to take a little break from things and revisit it. I obviously can't give up. I have to make sure she gets her fluids, but I wasn't sure. Laura, Ivy lady, I love that. But yeah, when I got here, Jill told me that um, she was being a little twitchy, and I had just noticed it myself, and I was glad she brought it up because I don't always want to bring up when I notice issues, but I am going to. Sometimes when I
There she
see them,
goes.
she's like, nope, I'm taking off. I kind of observe and take them in to see if it's a one time thing and it's a fluke or if it happens again. And it happened twice, but when Jill mentioned that she was a little twitchy, I asked her some important questions of like, oh, did it just start today? She mentioned it had been all day long. So you're kind of asking those W questions of who, where, why, what, how. So I want to know, when did this start? How long has it been going on? How long has it been happening? So that I can kind of gauge the situation and elaborate on the questions from there. So then I kind of went through in my mind all the different things that it could be head to toe. So when she was twitching, my first concern was, we didn't give the fluids in the same spot we normally do and in the spot that they usually recommend. So I kind of went down a little rabbit hole of, oh my gosh, what's the most extreme thing that could have happened is, did I hit a nerve? And I actually said, when we're being taught how to give IM injections, intramuscular injections in the rear legs, they tell us you have to be very careful where you give them because you can hit the sciatic nerve. And in some patients, it's real prominent, and in others, it isn't. So they make sure we know where to give them. That is part of our very specific training. They never discussed that with sub-Q fluids. So, as I told Jill, never say never. It has to happen the first time at some point. Um, it may never happen, but I can't sit there and say that we didn't give it in a different spot, trying to adapt to the situation. And now she just started to lay down to rest. And we didn't hit a nerve. And because I have sciatica, I think about sometimes I just move the wrong way. I sleep the wrong way. I sneeze, and then all of a sudden my sciatica acts up. So she's been acting a little bit hunched over, which can be a sign of back or abdominal pain, which we've kind of talked about in the
Mm-hmm.
other videos. So I already know that she may have pain somewhere, and what we did yesterday, kind of struggling to restrain her, might have caused some more pain, just like it would with us when you do a workout and you're sore. So we're either dealing with a component of pain or on, a minor or a major level. Um, when I saw her continue to walk, that's when I noticed that she was walking very tenderly. It almost looked like with her rear feet, she was not putting them down as much. She was a little bit on her tiptoes. So that was something I hadn't noticed before. And she was just walking gingerly. She wasn't as peppy. And then she went to go eat and she ate so much. And then I felt better because, again, one of the ways you can tell, the top way that your pet isn't feeling well, is if they're not going to eat. So that made me feel a lot better. But
She ate with gusto.
yes, I mean, I've never seen her eat that much. So that made me feel really good, but it doesn't mean that we don't have some kind of pain going on. So what I advise Jill to do is just touch base with her vet, one of the doctors I work with, to make sure of what dose of GABA, which is our pain medication, she can give, because it can be given 3 times a day. So we want to make sure we're at the proper dosing to help her, and we're not going to overdose or underdose, but in this case, overdose, because right now it's prescribed twice a day. And I told her, just keep an eye on her, and if she feels that she's continuing this tomorrow and it's okay and it's manageable, then we can get to our recheck on Thursday. Or if she's in a lot of pain, then maybe we want to get seen sooner. Dr. Barksdale, which is her vet, is in tomorrow as opposed to Wednesday. So to keep the consistency, it might be in her best interest to get seen and make sure we haven't injured ourselves, or maybe it is still related to the kidneys, that we have abdominal pain, or I even went as far as maybe the kidneys aren't filtering like we want and there's some toxins going on, and that's causing the twitching. But head to toe, you kind of look at things, you go through the body systems. We're looking at her kidneys, the endocrine system. We're looking at her, maybe it's a sign of seizures, so the neurological system. So there's a number of things it could be, and also may not be anything at all, just old age, she's just walking different because she's older. But one of the things I said to Jill is, your pet best. This is my motto, basically. And I don't want someone to dismiss something. I don't want someone to be too crazy and overanalyze. But, if you notice something and it seems minor, say something. See something, say something. If you see something and you're watching it consistently, I don't want you to drive yourself crazy. I don't want you to make, what is this saying, a mountain out of a molehill or whatever.
Yeah.
But it's really important to just monitor. And I told Jill, just keep an eye on it. Keep track of when it's happening. If you can figure out if it's happening more often, less often, if it's getting worse, because these are important things. And we would rather know than not know. I'm one of those techs that just tell me. If it's minor, tell me. If it's major, tell me, definitely. But, if you see something little and you think, oh, it's no big deal, it could be. So we would rather know than not know. And I don't want people on the opposite end to go crazy watching constantly and be like, oh my gosh, every little twitch is that something. But you definitely have to have your eyes and ears open.
You know what? This is really good advice, what she's saying, because, Muffin has vestibular disease, which means that she does get a little, like, the sunshine bothers her, and it makes her twitch. So that is kind of normal. However, I noticed that today it was more than usual.
Yeah, and that's important words to use. More than usual. It's abnormal now, whereas it may be a normal thing for her, but now it's something that is a little bit abnormal.
Yeah, and so it's helpful for you to tell me that, because I don't want to think anything's wrong.
Yeah.
But at the same time, knowing what I know now and what has happened, I want to know everything, and I want to be ready.
I'm hyper aware. So you're kind of looking for things as you should be. So sometimes it could make you crazy, wondering, oh my gosh, is this something or isn't it? But if it is something that is a little normal but less than normal, say something. If it is something that is abnormal, completely out of the norm, say something. So this is something that she deals with her sight, with her cataracts, that she has sensitivities to light, so she may twitch a little bit more, especially with different shadows. But for it to be happening at abnormal times, happening when it normally doesn't, that's when there's something else going on.
Because it doesn't normally happen in the house.
I've never seen her twitch, so that's spending quite a lot of time together, and that was immediately when she did that, I was like, she's never done that before.
And then I said something right away.
She said it immediately, and I was like, great, I was just going to keep watching her, and it happened again, and now hasn't happened since. So I'm not as alarmed, but Well, there was a little bit
Yes.
of a head shake, so
Yeah.
just kidding. But that's what you need to do. You need to say, all right, I have my feelers up. Let's continue to watch this and see if it's something. But, she definitely, after that, my concern was just her mannerisms. Her body looked like she was uncomfortable and in pain. Now she looks fine.
Yeah, she's
But it doesn't mean in that moment she
just
had just
laying.
been laying down in the
Yeah.
bathroom. So
She'd been
sometimes
sleeping.
sometimes when I sleep all night and I don't toss and turn, I
Mm-hmm.
wake up and I'm like, oh my God, that was a nice sleep. I got such a good rest, but now I can't move. My body hurts so much because it's not used to
That
that.
does
So it
happen.
could be something as simple as that. And
Mm-hmm.
you know what? I can say, everybody, this is what I do with all the patients. It's what I do with my own pets. I'm going to sit there and analyze everything and go through all these scenarios, like minor to major. And you can't drive yourself crazy. It's my best advice. And hopefully, you have a really great vet that has a nurse line, and like ours do, where you can ask these questions and you don't have to bother the vet. You don't have to run in for an exam. And that's why we established that, to be able to help people out so that they're not
So
dismissing
helpful.
something. Yeah, and then their patients aren't seen, and they really need to be. So yeah, so if you have a vet, I would say, even if they don't have a nurse line, call and ask. Make sure, that's what they're there for. It's their job. And they're the most compassionate people on the planet, I think. So I know that they're going to want to help rather than not. And
Yeah.
if you don't get that impression, time to switch vets.
Yeah, go run.
Yeah,
screaming.
that's a red flag. That is a red flag. If they are not compassionate and understanding, yeah, they may lack patience, but they should want to be helping you, even
Yeah.
if it's a nuisance. Because I can say sometimes I'm like, oh my God, seriously again. But I know what it's like. I can put myself in their shoes and say they don't understand. They don't know.
It's true.
And I do, and that's why I'm here. This is why I took this job. So I can't sit there and be like, oh my God, I don't want to deal with this. Well, they don't want to deal with their pet being sick and not knowing what's going on. That's worse than me not wanting to have to answer a question, which I rarely have those reactions.
And I don't want to deal with putting a needle in my dog.
Yeah.
I really don't want to do that. And I know some of you are like, Jill, you can do it, And I'm like, I don't want to do it. I really don't want to do it. It's just too much for me. And I'm squeamish to begin with.
Yeah. Listen, I love that they're cheering you on, and just, I say, absorb that positive energy and just turn it into healing energy for her.
Yep.
Take that, keep cheering her on, keep the prayers coming, but ultimately you don't have to.
And if you ever, thank you.
Who knows how long we'll be doing this? If you watch this long enough, you may say, you know what, now I feel differently.
I agree, and that could well be. And a lot of people have told me that, the more you see it, the more, you might think, hey, I could do this.
But right now, it's only been 5 days.
No, I cannot do it.
There is absolutely no pressure. This is so brand new, and it's one thing to have to understand the diagnosis. It's another thing to have to have a hand in making it better. We're talking about mental, emotional, and physical things here.
Yeah.
And that is overwhelming.
It's a lot.
You figure out what you can do, and you focus on that, and you put your energy into that, and what you can do is being her support.
Yeah.
And that's what she needs, and she loves that, and she senses it. So she's calm now, hopefully.
Yeah. She's thinking about something right now. She's like, should I go over there, be with them, or what do I do?
She's listening. She's like, what is she saying exactly? How should I react?
I'll show you guys. She's so funny. She's so expressive, even with just laying there.
Like, see, she's sniffing. She's like, what? I'm not just laying here. She's like, I'm making plans. I'm making moves in my head.
Yeah, you can see she is always making plans. Yeah. That's a Muffin
She's thinking of the next beach report. Where are we going tomorrow? She's like, I got to be feeling better.
She loves the beach report.
Yeah.
She knows all about it. Yep. She knows when the camera's on her.
Yep. Yeah, because listen, if she didn't want to be here, she would leave. She'd go in the other room.
She knows that
when
she can
didn't
leave.
Want the fluids, she put up a fight. And so she wants to be here with us, which I appreciate.
Yes, thank you, Muffin.
Glad that she doesn't go running at the sight of me.
No.
She's just looking around like, what? I can barely see you.
I didn't do anything.
What sight? What do you think, girlie?
It's funny. She really is tuned in to everything.
Hi. Oh, She's like, don't touch
Wait
me.
a minute.
Oh, so, well, actually, that's good, because I don't know how much everyone else sees of her walking, but for me,
Yeah, that was a
talking
little
about her
wobble.
vestibular,
Yeah.
you know, that's your system that deals with balance and motion and your spatial awareness and everything. It has to do with your, like, inner ear and everything.
Right.
So, geriatric vestibular disease is something that just comes on suddenly, where dogs all of a sudden are going to walk in circles. They're spinning around. They get really dizzy. They have a head tilt. They have a nystagmus, which is when your pupils, your eyes are twitching back and forth, and they're really nauseous, so they won't eat. She definitely is off balance, so she's got a few issues with her vestibular system. But when she just got up, then when I went to pet her, thinking that I was being kind and I disrupted her, she was unsteady. Whereas normally she's not that unsteady, and that's what I was watching before. After the twitch was her sitting here and her being hunched, and if you guys can see, she's kind of sitting. It looks like she wants to go sit, and then you see how she gets up a little bit, and then she kind of backs down like she's going to sit, but she doesn't. These are all signs of, for me, and my opinion is, I think there's something painful with her back. The hunched over, my first thing is her back. A doctor will palpate her abdomen, so they're going to feel her abdomen. She's like, no problem there. And whoa. She'll feel her abdomen.
She is acting weird.
Yeah, but like, you can see, like, to me, like, her legs being splayed out a little bit more. And then if you guys can see, like, down her feet, they're not like coming down all the way. She's on her tippy toes. There's just a little bit weirdness in her gait, which is her walk. She's not walking and moving like she normally does. She's a little bit unsteady, and I was just watching her before, and then we decided, well, this is what we're going to talk about, because she's definitely off, and it could be something as simple as, you know, her vestibular system. But see her head shaking right there? It's her unsteadiness.
She's hungry again.
Yeah, and that's a good thing. It's good that she wants to eat, but you know, I'm still all over the place. That's what I'm going to say, because now watching her move and be a little unsteady, I'm back to, well, I hope her kidney levels are okay and they're not at a, like, for lack of better words, at a toxic level, that we don't have like an issue with our kidneys causing us to be unsteady.
Oh.
And this is why our field is so difficult, because I have talked about a handful of things now, overwhelming things, trying to figure out what is wrong, and we don't know because she can't talk to us.
Yeah.
Not that she would know, that
so
she could sit here and say, my
she wouldn't
kidney.
even know it either.
Yeah, but because they can't talk to us, diagnostics are the best thing. And sometimes people think that, well, they're just trying to get money. We don't have any other tools that we can use to figure things out. So if you go into the vet tomorrow, she's going to do her head to toe exam. She's going to look inside and see if maybe we have an ear infection, causing an inner ear problem, causing our balance to off, and it's something simple. Ear infection, totally treatable. She's going to feel her abdomen and see, does her kidney feel inflamed? Is she painful in her abdomen? She's going to palpate along her spine and her neck and see, can she elicit any pain response there to know, oh, it's our pain. So then do we need to treat with pain medications? Do we need to adjust our protocol? She may sit there and say, all right, you know what? It's 2 days early. We are going to recheck our kidney values today and make sure we're not toxic with our kidney values. So there's a lot of things that are going on here. There's a lot of systems that could be affected, and we don't know until we do some tests. Sometimes we need to do x-rays, and I tell people, we've got 2 tests. We have a picture, and then we've got our blood work, which are our values. And sometimes the picture is going to show us nothing, and then we have to do the blood work. We never know. Sometimes we're going to do the blood work, and it's all normal, and we have to get those images. Sometimes both of them show us nothing, and we have to then treat symptomatically. That means treating the symptoms. So if we're vomiting, diarrhea, not eating, treating those symptoms specifically. So yep, and I agree, Pam, it is very hard when they can't tell you. It is the hardest part of this job.
Although I would say she is telling us everything.
Yeah.
I mean, I feel like I'm getting all the information.
You
I
are
just don't know what it
in
is.
tune with your dog. And that's, as you would hope with a 16-year relationship, you know. So hopefully you can figure it out. My hope is she just wakes up tomorrow and she's fine.
Yeah.
And this is
Big
nothing.
time.
And we're just,
Mhm.
super worried because we love her so much. But
Yeah. Yeah. But it is really good always to see her eating, and she's back at it again. She was never a big eating dog, like, those
oh,
dogs
back
that
in the
want to eat
day.
all the time. Yeah, back in the day. Never like that. I didn't use treats to get her to do anything because she didn't really care about food.
She was like,
But
it's
yeah,
there.
but
I'll eat
now
it when I
she's,
want to eat
yeah,
it.
now she's kind of like, food is the best part of my whole life.
I mean, I am really, really pleased that she's eating as much as she is.
Yeah.
Because that tells me that if she was um, not eating, she really doesn't feel good. So the fact that she's eating, she doesn't feel that badly that she wouldn't eat.
Mhm. So do you think we should still be doing the fluids today?
Absolutely.
Okay.
Oh, she's not throwing up.
No, she just put it on the side. Sometimes she pulls the meat out of
Yeah,
her
the
bowl.
only time that I would say we wouldn't do fluids is if we were trying to do it like yesterday and she's crying out in pain and she's having so much pain. And every time we try to do it, she's screaming and crying, she's flying, and she's becoming stressed out so much to the point where she became limp or lethargic.
Yeah.
Um, and it was causing her distress. So distress can look like a number of things, but like I'm looking at, are they suddenly open mouth breathing? Are they having issues with their breathing? We don't want to stress them out, stress their heart out.
Yeah.
So, I mean, yesterday I considered, are we going to just give this up? Do I have to come back later? And I was like, no, we're going to get through this. We're just going to give it some time. But I always tell people too, your pet best. If you feel like she's getting really, really stressed, if you feel like she's in a lot of pain and this isn't working, let's just pause.
I was close to that, but then she calmed right down and everything was fine. By the way, you guys, Tracy has asthma. Okay.
So I have asthma, and I was saying yesterday, I get this like tickle. I have reactive airways, so sometimes certain things trigger it. I don't know what it is. Sometimes I do. It's anxiety. I'm not anxious, but sometimes these things just happen. But I become anxious when it is happening. And actually, now talking about it is slowing my heart rate down and reminding me it doesn't matter. Nobody's looking at me. Nobody cares. I know that, and I don't care what anybody thinks. I'm coughing. I just want it to stop. Yeah. So I get anxious, and it makes my throat close up. And I don't need an inhaler for it when it's something like this, but I take more holistic things from Amazon. This company called Boiron that has something that is just for your airways.
Oh, what's it spell that?
Boiron, and it's these little teeny tiny balls, and all it does is one awesome special plant ingredient that just helps open up my airways.
That's so great.
I don't know if it works.
My husband had asthma,
but
so yeah.
I take them, and I don't have them with me, obviously. They're at work because being at work, I'm allergic to all animals, actually.
Oh, no.
I had to get allergy
the
shots in order.
The allergic to the animals.
In order to do my job, and it worked, and it helped. But
wow.
It still triggers me with certain things. The asthma, it's never gone away. It's only getting worse in age, I guess. But yeah, so if you guys hear me coughing, sometimes that's it, and I'll do a better job at saying to myself, okay, let me just pause, let me take a break and go get some water.
You're allowed to do that on the Beach Report. We're good with it. We want everyone to survive.
Yeah. So, but that's kind of like my situation. So, and that's kind of very similar to Muffin, trying to figure out, why is this happening right now? Sometimes you don't know. Sometimes it's just happening.
Exactly.
And there's no rhyme or reason, and you just gotta keep moving on. So
let's see what she's up to.
But hopefully she does well with her fluids today. I'm like I said, I'm very happy she's eating, so I hope she'll be cooperative. And I think today, if she is being less cooperative, I really want to try to at least get something into her. Yeah. I don't want to not, but if she's being less cooperative, I'll probably push to go in tomorrow to have her seen, because one, we can do the fluids there, we can have an extra set of hands, but also we can gauge it tomorrow. We can sit there and say, all right, we couldn't get it today. We're doing this bolus. That means a large amount at a time initially. We could potentially skip a day. Yeah. She prescribed it for every day. Yeah. I don't want to skip it, but I also don't know what has caused this, and I, do no harm. I don't want to try to do it and have her be in pain.
Right.
I don't want to wrestle her. I
No.
don't want to, be doing this and have it be a problem. So,
Yeah.
yeah.
What do you think, Muff?
She's like, I thought my dinner was really good
She
tonight.
says-
I loved it.
She wants to know if there's any chicken chips.
Yeah. Oh, I forgot
Oh,
chicken
well,
chips.
I have one left in the
Oh
little
my god.
bag.
See what my mom
It's-
always says, mine is a terrible thing to waste.
I should have texted you.
Yeah,
Yeah.
I tell people, like, text me whatever. Remind me when this is
Yeah.
over. No, I'm gonna do it right now. I can bring my phone out. I'm gonna put it
Chicken
in my phone, get
chips.
chicken chips.
Well, we have one, so we're gonna
I
have
knew
to
I would
make do
forget.
with one.
Yeah, I mean, we broke the other one up yesterday, so chicken chips for Muffin.
What you doing, Muff? You looking for some chicken chips? I think Tracy can find chicken chips for you.
Yeah, you want to have some? You want to come over here? We'll do your fluids. Hi.
Look at the face.
She looked right at me like,
No,
no.
I saw
Are
that.
you kidding me?
Yeah.
Absolutely not.
That was the face. Now she wants to roll a little bit.
Yeah, Bear was rolling after his too, and just like I talked to you about Bear, I talked to Bear about you. What do you think?
They need to meet each other.
They really do. I think this would be a good little. Oh, why can't I break it? Come here, Muffin.
Muffin, look
You
what we
want a chicken
got.
chip?
Chicken chip.
What do you think, Mama?
She's ignoring you.
Yeah, well, sometimes I think, like, with her sight, she's, like, listening, so she's moving her head around,
That's
listening,
true.
and she's like, oh, I kind of know she's behind me, but I don't 100% know, and there's not enough to coax her other senses to come when the food is there, and she's like,
Yeah.
well, why am I going to go? Like, if the chicken chip was right there, she would 100%, like, the other day,
Definitely
go
should
for
be
the treat
on
because of the
top
chicken
that.
chip.
Mm-hmm. Well, I do also suspect that her good eye is not as good as it
Yeah.
was. So I think, but I mean, she does.
She sees
She
well
does
enough.
see.
But you see, there was the
And,
little head
yeah.
twitch. So it's happened about 5 times now. To me, that's a lot.
Yeah.
In, like, the time span that I've been here. That's a lot.
Where you going,
So
Mom?
5 times during the day, I might have said, yeah, that's a lot. But 5 times right now, to me,
Yeah.
is weird. She's taken off.
And she's leaving. Where you going,
But
Mom?
even just yesterday, she had more pep in her step when she went. She did 2 laps yesterday. So
well,
the fact that
she's doing a lap right now.
Yeah, she's just
I think she'll be back
less
in a second.
active. Like, she's not as fast as she was,
Yeah.
which is totally fine.
Yeah.
You know, she's older, but we, as I said, I'm
She'll
a
be
analyzer. I'm like wondering, what does this mean? Does this mean something or nothing?
She'll be coming down the pike any minute now.
Yeah, she's like, all right.
Although she's doing kind of a reverse lap. She usually goes
I know. I was just gonna say,
counterclockwise.
yesterday she went the other way twice.
Yeah.
So. And that's something too, you know, it might sound crazy, but if they have routines and then they break them, even if it's as crazy as saying she always goes counterclockwise, or like they always rub after the sub-Q fluids and then they didn't, to me, that is them telling us something. Could be nothing, but they only have so many ways to communicate.
That's
so.
true. Oh, what?
Oh, she came back around. She's like, just kidding. But at least, you know, I saw the comment, like, when their tail is down.
Yeah.
Yeah, at least her tail is up now. She is wagging it. So, you know, if her tail was continuing to stay down, you know, I'm leaning more towards the back. But I feel like I've gone, like, back and forth so many times now watching her, trying to figure this out, when sometimes the best thing is getting to the vet and having them do what they do best, doing their exam, because they know exactly what to look for.
Yeah.
And if they can't figure it out upon exam, they do the test. So, because otherwise you're going to sit here and drive yourself nuts trying to figure things out when we can't have that conversation.
Well, I'm going to go get her.
Yeah, she's not.
I
making
think
her way
sometimes
back.
she gets a little bit confused too about where she is.
Oh yeah, I'm sure.
You know, at the.
Sometimes I get confused and I have no excuse. So.
I know, right? The struggle is real.
We joke in my family, we get lost in cul-de-sacs because my mom did one time driving on vacation. And if you talk to my oldest daughter, who's just turned 14, I get lost going into Disney's parking lots. I'm there all the time, yet I get flustered and then my brain shuts down. So I have no excuse. Muffin certainly does.
She does.
And now Muffin's fluids, at the end, at the end, it's definitely 150 in there, and I said it kind of looks like a little bit more to me than like I even measured it with my fingers. It is marked as it is, but I told her if she's doing well, we'll give it all, but if she's not, I'm not gonna like push it. Here, it's right here, sweetheart. We'll just, I go by feel sometimes a lot with things. Oh, she kissed me.
Oh.
She's like, I'm just trying to get the chicken chip.
Yeah.
But by default, I appreciate
You can
that.
take it though. You take it as a good thing.
Listen, how many times do they refuse chicken chips at the vet? So the fact that I could hold this and she takes it from me,
Yeah,
it's just me
she
establishing
wouldn't.
that bond and that association. I'm in my scrubs, I smell like the vet, but I'm also here helping you, and it's not all bad things.
No, it's not. And she normally wouldn't take a chicken chip
Yeah,
from anyone.
Because the first couple times she wouldn't, sitting over there, and
Yeah.
so now little by little each time she's doing a little bit more, and that just makes me feel good because I'm building a bond with her, and I'm trying to show her that I really care about her and I want her to be better, and that's like the goal. So
everybody is show don't tell, you know.
Yeah. I don't know, did I say it on the other videos? I saw Muffin in the back out of her appointment when she was going in the back to get sub-Q fluids, and I was just passing by and I was like, oh my god, that is the cutest dog ever. I'm like, who is that dog? I was like, I love her. I was like, look at her, and I went boo 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 little face, and then I kept going with my appointment and doing things, and then I ended up in passing
Here.
Dr. Barstow being like, yeah, I gotta give her sub-Q fluids, and I forget what she said, but I was just like, I can help. And literally, it wasn't even a thought. It didn't matter what she said.
Thank you, Lord.
Exactly. And but I just remember I saw her and I was like, she's just the cutest thing. I'm a sucker for cute.
Here,
I'll
let you do the chicken chip.
Yeah. Here, let's give you another little piece, right?
Now.
Here, you want to give it? Oh, she thinks. See, she heard it. She thinks that it's
fell.
down below her.
Yeah.
She's not used to it like being. Yeah, and that she literally tried to. She's not just trying to lick. She actually opened up and like bit my hand, like
with her gums.
But she literally was like, I can't get it. That was adorable.
Oh, she is so adorable.
All right. So as always, I'm just checking the fluid levels, even though I know where they are, and we're gonna finish the bags. I like to just make certain that nothing's changed in a little bit, and after she finishes this, we'll go ahead and hopefully get her fluids in. Again, I'm not upset if she wiggles. I take that as a good thing. I don't want her to be complacent.
Right.
She's a spunky dog. She has personality. I want her to have her energy. I take it as a good thing.
Good. Okay. Good to
know. If she never lets me do it, then we gotta reevaluate things.
Should we start with the blanket since it worked well last time?
Yeah, absolutely.
She said, "Give me some more chicken chips."
You guys see, she's just trying to take
people.
Say hi, everybody. Oh, I love her.
She's so cute.
She's so cute.
All right, come to mama.
Yeah. So, what do we think?
Okay, I'm gonna hold you, baby.
Yeah. Give her a little bit of pressure. I want to make sure that, we are. Oh.
She's already like, oh no, you don't.
I'm gonna do it more like around her neck, I think, to give her pressure and comfort, because I don't want to go as low. So Mom, I'm gonna want you to like hold your hands up here by her head and hold her to you.
She's already not
she's
happy.
like, I'm not doing this today.
Nothing has even happened, you guys. Oh, the wildness. Oh, the wildness.
Goodness. Here, let's see. Okay. So and I'll show you guys too, when we hold, we always put a hand around their neck, but you see how she's pushing me down? I'm going to take her legs and put them between my hands here and hold her like that. So that's something you can try to do.
Okay.
So just between my fingers. So this way you're extending them down and she can't push them up towards you. So see, I can walk around like this and do whatever.
Yeah.
And then, hopefully she doesn't get them out. And then what I do is I have big hands. So I'm putting my whole hand on her body to give deep pressure here and holding her to me. Obviously, I do this all the time. So it's easy for me.
Yeah.
It's something you have to get used to.
Yeah.
So, but see how she's calm, and I'm not suffocating her. I'm not squeezing her to death. You guys obviously can't see that. I'm just giving her pressure, and I'm putting her to me, and I'm being calm, and I'm letting her breathing match my breathing, and her heartbeat match my heartbeat, which is low. And I've seen this
was helpful yesterday.
A TikTok that did this and worked with aggressive animals, and I was like, oh my god, that is so interesting. I'm like, now I understand.
It's like a baby.
Exactly. So this is what I would say for you to do, Mom, if you feel comfortable holding, because Yeah, whichever way it works for you. But now she's like, what? Let go.
Oh,
But you see how she settled down? And I also, again, the music helps. So you have to figure out what works best for you too, because you're not used to this.
You're wild.
Yeah. Okay. And you know what? Honestly, they're always different with parents. So she will sit there and be like, "Oh, it's mom. I know if I'm upset, she won't make me do this." And yeah, you know, maybe that's not what's going on, but a lot of the times we have pets are better away from parents or better with parents.
It's
and
that way always with the groomer. That. Yeah.
Yeah, so.
Okay,
Mama.
baby. Okay.
It's okay.
It's okay.
It's
Mama's
okay.
got you. Mama's got you.
It's alright. You're okay.
You haven't done anything.
Alright.
Nothing's
You're getting yourself all worked up. I know. It's okay. I just want to make sure, you know, like I said before, she doesn't hurt herself or mom. Should
we maybe let her run around a little bit?
Yeah, you want to get your energy
out?
What do you think?
Do you want to run around and be wild?
Then, I did that, like, I call it a kitty burrito because that's when we use it the most. And we're doing things in the rear for them, but I can also do that like we did the last time, like, and do some deep pressure, just like you would when you're holding a kid for a little bit and see how that goes.
She didn't just run away, though. I just put her down, and she's not bolting.
She's right here, so.
She's right next to us.
But yeah, she knows what's about to happen. They're aware. The minute she's been here hanging out, and the minute we did this, she was like, no. And you know what? They can associate the towel with that, too. If we're always using the same one, she's going to see that. You take it out, and she's going to be like, no. No way. My favorite story to tell people is that I had a client who drove the same way to the park that they went to the vet, and the dog always knew when they were going to go to the vet.
Because
always
of the towel.
knew. No, just because it was just the route. They took the same route to the park
they
and to
know
the vet,
everything.
But that's it. They wouldn't say anything, and then all of a sudden would like freak out and be like, "How do you know we're going to the vet? It's the same way as the park. Why don't you think we're going to the park?" It's incredible. They're very, very, very smart. They sense everything.
Yeah,
so
they sure do. Okay, you good girl.
And see, now she's calm with you. We let her choose to kind of come back. And I know it sounds crazy, like, oh, whatever, they don't have a choice. They absolutely do have a choice. Like, in my world, they have a choice.
Definitely.
Let them be here and be calm. So.
Princess Muffin has all the choices. She tells me everything.
Yeah. And you being calm and holding her, and she's going to calm down.
Well, or not.
Yeah, hopefully. It's okay, girlie.
It's okay. We're right here.
Okay. And sometimes we tell people to bring them into the vet, and when there isn't an appointment, just so they can associate that they don't always go there and something happens, especially the really anxious animals.
Yeah.
Good girl. Stay nice and calm.
She's not anxious at the vets normally.
Yeah.
She's always.
And she's not anxious now. She just doesn't want it.
Yeah.
And you have to understand, it's a big needle. Who wants to feel that poke? That's all she knows is that stab. As gentle as we are, and as slow as we go, she doesn't want it. She knows what's happening. It makes her feel better, and once we do it, she settles down. She's like, oh yeah, I feel better. But it's just like when you know you have to pull a Band-Aid off. You don't want to do it, or you know you have to do something you don't want to do. You delay it. She doesn't want it to happen because it causes her pain. It's nothing more elaborate than she knows. She knows what's happening. She doesn't want it to happen, but it'll make her feel better, and we find ways to adapt.
It's okay.
It's okay. It's okay. It's okay.
It's okay. Mama's got you.
See?
I got you.
And now at least she's realizing when I'm touching her, I'm not each time now just automatically doing it. I'm not like, all right, we got to do this and get this over with, and I'm going to stab you and make it traumatic. I'm petting her while this is happening and showing her you're
hurting
okay.
You're all right.
It's okay, Mama. You're getting yourself all worked up. Your tongue's falling out of your mouth.
Yeah, don't get all excited.
There we are, Mama. Good girl.
Good girl. It's okay. I got you.
It's okay.
Oh my goodness. Oh my goodness.
Hey.
Everybody's fine.
Oh my. Do you want a chicken chip?
Yeah, honey.
You take it here. And that's something too, if you guys know they like treats and you have two people helping you. We do this at work. Sometimes we'll feed peanut butter. So obviously, if we don't have any allergies to it, this is a chicken chip. We want to make sure they don't have any
How
allergies
often
to
do
that.
dogs have allergies to peanut butter or chicken?
I don't know a dog that has had an allergy to peanut butter, but the parents might. So we have to be careful if they're licking the peanut butter and then going back in.
Oh, that's true.
But chicken is the number one allergy. So when you have food allergies, it is always the protein. So we're switching from like the chicken or beef to trying salmon. And sometimes it's even as elaborate as you have to feed them like kangaroo. And
Give her more chicken
Good
chips.
job. She took that from you.
Yeah, see, it's not this bad when we're eating chicken chips out of people's hands.
Well, listen, if she really did want to do it, she'd continue to thrash, and she would not take the chicken chip at all.
Very angry.
She just, it's a lot going on, and you know, also
give me that chicken
on that
chip.
level of sometimes maybe she doesn't know where she's going in there. Maybe she doesn't understand what's happening. I'm sitting here saying she knows and she doesn't want it. Maybe she doesn't know.
Maybe she
and
doesn't.
She's like, wait a second, we don't normally do this, Mom. Why are you holding me so tight? You know?
Yeah.
There's a lot to it. So
chicken chip.
I'm gonna text
my God,
next client real quick. And
there's got to be
I'll
crack in these chicken chips. I don't know what
there's got to be something. There's something
like,
going on for sure.
Loves them so much, it's ridiculous.
I just want to tell my next client that I'll be there a little bit later for the nail trim.
Yeah, thank you guys for your prayers. I really appreciate it, and I know Muffin and I feel it. We know that you guys are out there pulling for us.
Yeah.
Feisty little dog we have here. So feisty.
Listen, like I said, I'd rather her be fighting it than getting to a point where she didn't react at all, was like lethargic, listless.
Right.
These are words that we use and we ask because
those are bad things.
Yeah, that's not a good thing. I mean, it's making it difficult and it's hard to manage, but I would much rather it than go the other way.
Yeah, she's pretty wild tonight, though.
Yeah.
I don't know. What do you think? Should we give her a day off?
We could. It's up to you. I can also try to poke and see what happens.
Okay.
I trust you. You know her best, and that's what I always sit there. I feel it's okay if we were to not do it, but I don't want it to go 2 nights. I also, sit there and like, how elaborate is this? Is she going to associate and be like, oh, if I do this, then I get away with it? Is she thinking that elaborately like a child?
I don't think she could, though. No.
So I'm not like those. I do know that a cat, yes, 100%.
Cats think like that.
would be like, if I mean, they'll get mad at you and they won't eat for a week. So
yeah,
I'm more concerned with the twitching and everything that we had going on. If there was an injury from doing this, that I want to make sure I'm not causing more of an injury.
So maybe it would be best to back off tonight.
We can definitely do that. And I would sit there and say, just, like before, maybe consider having a recheck with Dr. Barksdale tomorrow and say, all right, this is what's going on. But if she wakes up and you don't see her twitch at all in the first 2 hours or so, I don't know when she first started twitching today, like when you first noticed
when I took her out in the morning.
Yeah, I would say compare, see how it goes. If by noon you don't see any twitching, then totally fine.
Calm yourself.
But, I don't know what the schedule looks like for the afternoon. And so what my job also does is we call day admission. So if we don't have an appointment slot, we still want you seen. We have the availability to have patients be dropped off, and we see them in between. And we can, instead of someone having to wait a long time or having to come in on emergency, we can do things spaced out and say, all right, we have a chance now, let's do the exam, and then they tell the tech what to do and be like, all right, now that we have another second, let's do this test. So if for some reason, you feel that she needs it, again, we have our meeting tomorrow. You just text me, though, because I'll be there.
Okay.
And you don't have to worry about the phones not being on. I will make sure she gets scheduled or the day admission. And also, I'm there, so I'll easily make sure to say, well, I'm going to stay in health.
I got an insider here.
Yeah, and I do that with a lot of my clients. I'll be like, you can text me. I don't text the doctors after hours. I don't, make it a problem, but I do allow extra communication. And when I board in my home, that's what I offer, as well as that I have vets at the hands, if you don't go there, that are helpful, and I can ask them, and just to make sure that everybody is okay. So, but this way tomorrow, if we can't get her seen, and we don't have, because sometimes we're not properly staffed, people call out, people get sick,
Right.
tis the
Sure.
season.
That's
I'm
right.
there, I'm off, so I can stay to make sure that she gets the things
Good
that
to
she
know.
needs done. I'm gonna be clocked in for the meeting anyway, so
Yeah.
I'm
Yeah.
I don't mind doing that for her girly, and that's kind of how I am. I kind of go that, I'm gonna say, it's gonna sound weird, but go that extra mile. But that's what I do. I kind of I get very invested in my patients because
You're the kind of vet tech we want.
yeah,
I
right,
mean,
girly.
I feel very
Oh, okay.
blessed that
She's like, don't pet me.
she's like, don't touch me anymore. Yeah, no, I
Yeah.
feel blessed that I got you. Thank you
Well,
so
listen,
very much.
I feel very fortunate to have met you guys too. She's a wonderful dog. So, and I just hope my dogs live as long. That's what I keep saying.
Yeah.
And have as much spunk.
Yeah.
And such good personality. Because right now, my little dog, she kind of drives me nuts, but she's only a year old.
Okay.
So I'm like, you better turn out to be nice and calm and spunky like this in your old
Well,
age.
I always say it takes 4 years to get your best dog.
Yeah, it is
4
true.
years, and it's like miraculous. The
It is
4
true.
year. Yeah.
And you know what? When kids turn 4, that's like the golden age, I say. So
Also, yeah, good.
yeah,
Could be
and
good. Could be
so
bad.
we got my dog, and she was turning 3, and that first year was really rough. But like 4 to 5 has been glorious. So
Yeah.
I believe it.
Yeah. Yeah, and if you actually do want to get a dog and you want to rescue a dog,
Mhm.
it's a lot of people are like, I want a puppy, but that's not always the best idea, especially if you're older
Yeah,
and you've just
it's a
lost
lot
a
of
dog
work.
and you're not used to having a puppy around. It is a lot
A
of work.
lot of work.
So it is always better to adopt an older dog, and you
And
really will never be sorry.
you can even adopt a dog that's 2.
Yeah.
Listen, they come already trained. Who wants to
Well,
have to go
there's
through that
that.
potty training
But
and the
again,
teething?
4.
Yeah.
4 is
But
the
that's my
age.
thing. I would rather, my husband thinks I'm crazy. I just adopted a 13-year-old cat and a
God
17-year-old
bless
blind
you
cat.
for that.
But my husband, we had one of my hospitalized patients, we did surgery after hours, and I took her home with me so she didn't have to stay in the cold hospital when her parents were away for the week. And my husband at the end of the week was like, now I know why you want an older dog. He fell in love with her.
Oh.
Adores her. And I said, well, this is why, because they need love too, and
They actually
calm. There
need
are no
more love in a
issues.
lot of ways. And a lot
Yeah.
of the older dogs that have nobody, it's because their owner may have died or
Yeah.
something really traumatic has happened.
Yeah.
And they just can't be with their people. So, always look for those dogs. And
Ears, Englewood Animal Rescue is a rescue that solely takes animals that are being abandoned. So if they have like cats or dogs, they're not ones that they necessarily found like on the streets or anything or in the wild. And I love that so much because I know that there's a story, and I can't listen to the stories because I want to take everything. But if anybody is in this area and is interested, Todd runs
and that would be the Sarasota,
program.
Florida area, by the way.
Yes, Sarasota County, Englewood Animal Rescue Cold Ears. You can also check them out on Facebook and like them. They just are doing great things. It's just beautiful. And you know what? These situations happen. Everybody has their stories, but it's heartbreaking every time I see these animals just abandoned. I don't understand it ever.
No,
I never understand it, but they're there and they need homes. And I will tell you, when you adopt like that, they are so grateful, and that love. Oh my God, it's incredible. If you could just bottle that up, if we could just give that to the rest of the world, that's what we need to solve everything nowadays. That's how I feel.
Absolutely.
Look at her just.
Yeah, I
gotta
my
show
jacket.
you the I was getting hot. I was like, oh, I'm gonna take this off. I didn't need it to begin with. I don't know why I even came in with it. And she's just like, I'm just gonna claim this little corner of it.
She's adorable.
She really is. After later, she's gonna come over here. She's like, me?
What you gonna do? Who are we talking about?
But after all that, now she's like, I'm fine.
Yeah, maybe I'm ready for my sub Q.
But just see how she turns around like that. She's less steady than she was, and she's not like as fast. I just, and like going to sit down or I don't know. She just seems off today.
Yeah.
And
give her a break.
I don't want to cause harm, so.
Right.
Oh, mama.
Oh, Muff. All right, you guys. Well, I gotta let Tracy go. She's gotta go trim the nails of the
I
cat.
do. Yep.
I'm like, that
It never
sounds
ends.
dangerous.
Well, she's a good cat, but if it was a mean cat, probably wouldn't be doing it.
Yeah,
I'd be like, you have to come
exactly.
to the hospital.
Exactly.
Cats can be, oh, scary, just
Yeah,
brutal.
yeah. Well, and when trimming someone's nails, people too. I'm always so afraid I'm gonna hurt them.
Mhm.
Like
Yeah.
how do you know? Like some like dogs with black nails, you
Oh,
can't see the quick.
you can't. You
Muffin,
don't
at
know.
least you can see.
Yeah,
Not
it's
that I would do
nail
it,
trims
but
are
yeah,
my least favorite
yeah,
thing to do.
yeah.
When they're black, it's just so hard to see, and I'm so afraid of cutting them. I don't want to cause pain because they have a vessel in there. So if you cut them too close, they bleed, and it's
Mhm.
really sensitive. That's a nerve. I feel so bad. I am always like, no, I'll hold. Somebody else can
Yeah,
cut the nails.
yeah,
Luckily, my dogs have white nails and I can see, and I'm able to do them by myself. But my cats, different story. They're evil. I can't do them. They
yeah.
go for my throat.
Uh-oh.
Yeah.
Sounds bad.
Yes, it is. So I'll have to enlist another pet sitter to
All
come to
right.
my house to help with my cats.
Well, I'm gonna let you go and do that, but thank you so
No
much.
problem.
We didn't get to do our sub Q today, but
Yeah,
we did
but
get to talk about, and again, I think it's so important that you do notice, like Tracy's saying, like I noticed this, but I didn't know what to think about it. And now I do, like now I know what I'm looking for things. I'm, just constantly concerned.
yeah, it's definitely nerve wracking. My best advice is just continue to watch your pets. Don't drive yourself crazy. Ask the professionals. Reach out. And if anybody makes you feel bad for asking, then that's not the place for you. But
Yeah.
you know what? It's not easy to do this on your own, and we're here for a reason.
Yeah, by the way, Tracy is like was the fifth vet that we've been dealing
Yeah,
with for this. So, all right,
hard to
I'm
find your right place.
gonna say ciao for now and thank you so much. And we'll see you on the next beach report. See you guys later.
Bye.